Gentlemen, imagine waking up tomorrow morning with a level of firmness you haven't felt in years. Not from a pill, not from a pump, not from anything risky or expensive, but from something far simpler, using your own hands, the right way. Today, I'm going to show you 3 specific pressure points that help restore morning erections by improving blood flow, releasing pelvic tension, and reawakening nerve sensitivity. This isn't hype, it's basic physiology, and it's something your body already knows how to respond to. Before we begin, a quick question. How old are you and where are you watching from? Drop it in the comments. And if men's health and honest conversations matter to you, tap like and subscribe. That's what we focus on here. Now, before I show you the pressure points, you need to understand why morning erections fade with age. Because once you understand the mechanism, this stops feeling frustrating and starts feeling fixable. Erections aren't random events. They're the result of coordination between 3 systems: your nerves, your blood vessels, and your pelvic muscles. When everything is working properly, nerve signals tell the arteries in the penis to relax. Blood flows in, the erectile chambers expand, and the veins compress, trapping blood and creating firmness. That system works beautifully when it's responsive, but over time, 3 quiet changes begin to happen. Blood vessels stiffen and don't open as easily. Nerve signals slow and lose strength. And the pelvic floor, the muscles that help trap blood, becomes tense and less responsive. When just one of these starts to fail, morning erections fade. When all 3 decline together, firmness becomes inconsistent and unreliable. This is exactly why pressure point stimulation works so well. When you stimulate specific areas, you activate reflex pathways that connect directly to the spinal centers controlling erections. Those signals tell blood vessels to open, muscles to engage, and nerves to wake up. Without pills, devices, or forcing anything, done consistently, this doesn't just create short-term effect. It retrains the system. Circulation improves, sensitivity returns, and the body remembers how to respond again. Now let's start with the first pressure point, the one that reactivates the entire system. The first pressure point is what I call the base groove, a subtle but powerful spot right at the root of the penis, where the shaft meets the body. To find it, gently trace along the underside of the shaft toward the pubic area. You'll feel a slight indentation, almost like a hinge, where external tissue transitions into deeper structures inside the pelvis. This area matters because it's a control hub. Beneath the skin, the base groove sits over a dense intersection of sensory nerves and blood vessel junctions that feed directly into the erectile chambers. When this area becomes understimulated, which is common with age and reduced circulation, erections lose responsiveness at the very foundation. Stimulating this point sends 2 key signals at once. First, it tells nearby blood vessels to relax and open, improving inflow. Second, it activates nerve pathways that communicate directly with the spinal erection center. That combination, better circulation plus sharper nerve signaling, is exactly what aging erections tend to lose. Here's how to work it correctly. Place your thumb directly over the base groove with your fingers gently supporting the shaft. Apply moderate, comfortable pressure, never pain. Move your thumb in slow, steady circles. Let warmth build naturally. If the tissue begins to soften or feel fuller beneath your touch, that's a good sign. It means blood flow and nerve responsiveness are increasing. Work this area for about 1 to 2 minutes. You may notice warmth, tingling, or a subtle sense of fullness. These are not imagination. They're signs the system is waking up. If sensation feels mild at first, that's normal. This isn't about instant intensity. It's about retraining responsiveness over time. For best results, stimulate the base groove in the morning before getting out of bed or during a warm shower when tissues are already relaxed. With daily practice, many men notice their morning erections become stronger, more consistent, and easier to trigger within a few weeks. This point sets the foundation. Once circulation and nerve signaling are active here, the rest of the erectile system responds more efficiently. And that brings us to the second pressure point, one most men completely overlook, even though it plays a critical role in maintaining firmness. The second pressure point is one most men rarely think about, yet it plays a major role in erection strength and control. It's called the perineum. This is the soft strip of tissue located between the scrotum and the anus. It may feel unfamiliar to focus on, but physiologically, this area is one of the most important zones for male sexual function. Why? Because directly beneath the perineum lies the bulbospongiosus muscle, a key pelvic floor muscle that helps trap blood inside the penis once you're aroused. Think of it as your body's natural clamp. When this muscle is weak or inactive, which commonly happens with age, long sitting, or reduced reduced circulation, blood escapes too quickly, and erections lose firmness. The good news is this muscle responds very well to stimulation. When you apply gentle pressure to the perineum, you're doing two things at once: activating nerve pathways that feed directly into the erection reflex center, waking up and strengthening the pelvic floor muscles that support firmness. Here's how to stimulate it correctly. Sit comfortably or lie back with your knees slightly apart. Using your index and middle fingers, apply gentle but steady pressure to the center of the perineum. This should never be painful. Think firm contact, not force. Begin slow, small circular motions. As you do this, many men notice warmth spreading forward, a subtle pulsing, or a light tightening sensation. Those are signs that blood flow is improving and the pelvic floor is engaging. Stay here for 2 to 3 minutes. This area responds best to calm, consistent stimulation, not speed. If you want to enhance the effect, follow this with a few gentle pelvic floor contractions. Slowly squeeze and release the muscles you'd use to stop urination. This reinforces what you've just activated from the outside. With regular practice, this pressure point helps erections not only start more easily, but stay firm longer. Many men describe feeling more stability, more fullness, and better control. The perineum may be hidden, but it's a powerful ally. And now that we've addressed blood flow and muscle support, we'll move to the third and final. The third and final pressure point is the most sensitive and in many ways the most powerful. It's located just beneath the head of the penis, at the raised ridge where the glans meets the shaft. This ridge is called the corona. Anatomically, this area is packed with sensory nerve endings. These nerves aren't just responsible for pleasure, they are the primary messengers that send arousal signals to the spinal erection center. Think of the corona as your body's ignition switch. When nerve signaling here is sharp and responsive, erections trigger more easily and feel more natural. When sensitivity dulls, which commonly happens with age, reduced circulation, or chronic friction, arousal becomes slower and less reliable. The key with this area is precision and restraint. Too much pressure or speed overwhelms the nervous system. The goal is to retrain responsiveness, not overstimulate. Here's how to work this point safely and effectively. Using your thumb and forefinger, gently position them on either side of the corona ridge. Apply a light, steady pinch, firm enough to feel contact, never uncomfortable. Hold for about 5 seconds, then slowly release. Repeat this hold and release pattern for about 1 minute. After that, switch to slow circular motions around the entire circumference of the ridge. Keep your touch light and controlled. Spend another 1 to 2 minutes here. As you do this, you may feel tingling, warmth, or a sudden increase in awareness. That's the nervous system reconnecting and firing more efficiently. With regular practice, this doesn't just make erections easier to trigger. It often restores lost sensitivity and improves overall sexual responsiveness. Many men notice more spontaneous arousal, better feedback during intimacy, and a stronger connection between mind and body. Now, one thing I want you to understand, and this is something I emphasize often in my work, is that these improvements don't come from random effort. They come from consistency and structure. That's actually why I put together the all-in-one men's vitality and intimacy blueprint, to help men take techniques like these and turn them into a simple, repeatable routine that supports circulation, nerve health, and confidence over time. If you want a clear roadmap, you'll find it linked below and in the pinned comment. But here's the most important part. The real results don't come from working these points in isolation. They come from combining them into a simple, intentional sequence, one that activates blood flow, muscle support, and nerve signaling together. And that's exactly what we'll put together next. Now let's put everything together, because this is where results actually happen. Not from touching one point randomly, but from activating the entire erection system in the right order. Think of this as a quick systems check. You're waking up circulation, engaging the pelvic muscles, and sharpening nerve signaling, all in one short routine. Here's the sequence. Start with the base groove, right where the shaft meets the body. Spend about 90 seconds using steady circular pressure. This stimulates blood flow and wakes up the main nerve and vessel junctions at the root. It primes the system and tells your body, prepare for blood flow. Next, move to the perineum, the area between the scrotum and anus. Spend about 2 minutes here with gentle but firm circular pressure. This activates the pelvic floor muscle that helps trap blood inside the penis, which is what allows erections to stay firm, not just start. Finally, finish with the corona just beneath the head. Use the hold and release technique, followed by slow circular motion for about 2 minutes. This sharpens nerve responsiveness and improves how quickly and clearly arousal signals fire. Done back to back, the entire routine takes about 6 minutes. But in those 6 minutes, you've activated the 3 pillars of erection quality: blood flow, muscle support, and nerve communication. That's why this approach works especially well for men over 50. Now let's set the right expectations. This isn't a one-time fix. You're retraining systems that may have been understimulated for years, but the body responds remarkably well to consistency. Most men notice early changes within 2 to 4 weeks: more warmth, fuller partial erections, or increased morning sensitivity. Now let's talk about how to support this routine and the few mistakes that quietly hold men back. The first is using too much pressure. More force does not mean better results. These points respond to steady, intentional contact, not pushing or rushing. If anything feels sharp or uncomfortable, ease off. You're communicating with the nervous system, not trying to overpower it. The second mistake is inconsistency. This works by retraining circulation and nerve signaling over time. Doing it once or twice won't undo years of reduced blood flow. Daily practice is ideal in the first month, but even 4 to 5 times per week is enough to create change. The third mistake is doing the routine while tense or distracted. Your nervous system needs to be in a relaxed state to respond. Morning, before getting out of bed, or after a warm shower works best. Warmth naturally improves blood flow and responsiveness. Two habits that amplify results are hydration and movement. Dehydration thickens blood, and long hours of sitting restrict pelvic circulation. Simple walking, drinking enough water, and gently opening the hips can make a noticeable difference. And finally, don't compare your timeline to anyone else's. Every man's circulation, nerve health, and baseline are different. Some notice changes quickly, others build steadily over weeks. What matters is that your body is responding, even if progress is gradual. Closing, gentlemen, I want to leave you with this perspective. Morning erections aren't just about sex, they're a signal. They reflect how well your circulation, nervous system, pelvic muscles, and hormones are working together. When those systems drift out of sync, which often happens gradually with age, the body doesn't fail. It simply needs the right kind of input. What you've learned today isn't a trick or a shortcut. It's a way of reminding your body how it's designed to function. A few minutes a day, targeted stimulation, consistent signals to restore blood flow, nerve responsiveness, and muscular support. For many men, that alone brings back stronger, more reliable morning erections, and with them, confidence and reassurance that the system is waking up again. Before we finish, I want to briefly mention something many viewers ask me once they start taking this seriously. If you're looking to support erections, stamina, testosterone balance, and prostate comfort together, not separately, I've linked the natural supplements I trust and recommend below. They're science-backed, carefully selected, and designed to work together, not against each other. You'll find them in the description and pinned comment if you want to explore that next step. And remember, this channel is a safe space. If this helped you, share your age and where you're watching from in the comments. You're not alone in this, and your experience helps other men feel less isolated. As men age, this isn't the end of vitality. It's the beginning of a more informed, intentional phase of health. I'm Dr. Aria Brooks, and I'll see you in the next video.